Hello, you're watching Mad Historian TV. I'm Dr. Philip Drake, and today I would like to introduce our very special guest to the show, Nyasa Williams.
Hello there. Today we will be discussing and learning a little bit more about disease and illness of the 19th century. Throughout the 19th century, disease had become one of the least avoidable and most dominant causes of death. Although much technological advancement had occurred by this time, there were very little to no medicinal developments to better human immunity. Diseases of this time included cholera, malaria, yellow fever, typhoid fever, puerperal fever, tuberculosis, erysipelas, and gangrene. Let's start with tuberculosis. Tuberculosis, also known as TB, is a disease of the lungs caused by Mycobacterium. It is an airborne pathogen that is generally transmitted through coughing.
How did it affect people of the 19th century?
During this time, approximately 40% of the working population in North American and European cities died of tuberculosis. This brought many people to the belief that TB was a result of the industrial era. Today, TB is still very apparent in the world, infecting 1/3 of the entire world population. It wasn't until the early 20th century that it was discovered to be more commonly spread by carriers of the human immunodeficiency virus, more commonly known as HIV. Now let's talk about cholera. Cholera was by far the worst, nastiest epidemic of the 19th century. It is a severe bacterial infection caused by Vibrio cholerae of the small intestine, causing excessive watery diarrhea and vomiting. This eventually led to complete dehydration and, well, death.
Can you still contract it today?
Of course you can. Now, this doesn't mean that every time you have a stomach bug you should automatically jump to the conclusion that you have cholera, but it surely isn't impossible. In fact, many third world countries still face enormous death rates due to cholera. This is because it's contracted through fecal-oral transmission. For example, if someone with cholera's bacteria-ridden feces ends up in the water supply of the community, well, you know what that means. Everyone's getting cholera who drinks it. It can even be transmitted from contaminated food or milk.
So, how did it spread so rapidly throughout the U.S. in the 19th century?
Well, cholera reached the New York Harbor in 1832 and was spread to the U.S. via railways, canals, and steamboats, and existed mainly because of the poor sanitation system as well as constant dumping of infected waste. Here we have medical assistant Andrew. He'll help me to explain these next 3 common diseases and/or infections of the 19th century: malaria, yellow fever, and typhoid fever. Malaria, also commonly known as swamp fever, is a disease caused by Plasmodium parasites transmitted by the bites of infected mosquitoes.
Human malaria is much different from malaria protozoa found in animals.
Yes, that's correct. General symptoms of human malaria include chills, dizziness, fatigue, fever, muscle ache, and overall malaise, not to be confused with a general case of influenza.
Although it may not sound too bad, malaria is extremely dangerous, as the parasites attack your blood cells directly.
Correct. Malaria became a major problem during the Civil War and killed many veterans in the long term. Even some of our most well-known presidents, such as George Washington, Ulysses Grant, and Abraham Lincoln, suffered from malaria.
Yellow fever is also contracted through mosquito bites.
Correct. Yellow fever is an infection caused by a virus called a flavivirus. It is much like malaria, only it has a much worse effect on the body. Yellow fever has 3 separated stages that makes the patient feel as if they are recovering from a basic illness and then suddenly begins to kill them, causing organs such as the liver and kidneys to fail and leading to deadly hemorrhage and heart failure. From 1839 to 1860, New Orleans had consistent epidemics of yellow fever, which led to more than 26,000 cases of it in the U.S. It wasn't until 1900 it was proved by the Reed Yellow Fever Commission to only be spread by the Aedes aegypti species of mosquito.
So, salmonella is a type of bacteria, correct?
Correct. Salmonella is a bacteria that causes both systematic infections and typhoid fever and intestinal infection in humans. Ever gotten yelled at for eating raw cake batter and told by an adult you would get salmonella from raw egg? Well, this can indeed be very true. Salmonella is contracted through bacterially infected foods such as uncooked or undercooked meat, raw eggs, and contaminated water. It can also be contracted through touching animals such as turtles and certain birds who carry it on their skin.
Symptoms of typhoid fever include skin rash, high fever, abdominal pain, and constipation or diarrhea.
Along with cholera, typhoid fever was a top-killing disease and epidemic of the 19th century, as well as a major diarrheal disease. Really?
Sorry. Excuse me.
Typhoid fever was at its greatest peak the first year of the Civil War and gave everyone a hard time considering there was no treatment for it. Physicians even resulted in giving patients calomel, which eventually killed them from mercury poisoning.
Large families and short life expectancies were very normal in this century, yet when such epidemics swept through the nation, it was nearly impossible to maintain a family without everyone, especially children, dying.
Absolutely. Thank you so much for your help and time, Andrew. Before we end our show, I'd like to give a few honorable mentions of a few other common yet less popular 19th century diseases. Number 1. Erysipelas, a less common yet very contagious skin disease caused by streptococci bacteria. It generally results in high fever, chills, and swelling of the face. Treatment in the 1800s included rubbing iodine on the skin and laxative purging. Number 2. Gangrene, an infection caused by bacteria called Clostridium perfringens that causes the skin and tissue to rot due to lack of blood circulation. Appendages affected often appear a blue, purple, or black color and are very dry or cracked with foul-smelling discharge. During the Civil War, surgeons had become overwhelmed with the number of people who had this particular infection and simply began just amputating limbs altogether without the lovely anesthesia or pain narcotics we have today. You can also look at it this way. If you shoot someone, you're not aiming for their arms or legs. The closer the wound, infection, and amputation was to the core of the body, the higher the chance of death. This is the reason why amputees died regardless of operation. Number 3. Puerperal fever. This was an infection caused by difficulties during a natural childbirth or miscarriage. Women experienced vaginal or uterine laceration, which became a vulnerable spot for infection to occur and an easy passageway for bacteria to enter the body. Symptoms of puerperal fever included fever, abdominal pain, discharge, and chills. Many women contracted it through inadequate midwifery sanitation. So in other words, no one could just run and grab latex gloves, so whatever warts, pimples, or skin infections the midwife was carrying, the mother would most likely contract the streptococci bacteria from them. Well folks, that's all the 19th century grossology you get for today. Hope you all enjoyed the show. Thanks for watching. Until next time.
Make sure to tune in for next week's segment, a 20th century walk through the ER, here on the one and only Mad Historian TV.